Hello to all the viewers, to all the students, and this is a session on mixed math series for exam goers. And we are on, okay. So here we are going to discuss about all those important key things that is needed for you guys who are going to face the exam very soon. So this is mix and match for you. Here we will have some MCQ type of questions, we will have some picture based ones, and some are vertical integrations, and some are, of course, the horizontal integration questions. So we are going to see all sort of things, including the histology. So that is the concept. And here you are welcome to Mix Match series. All right, I'm Dr. Rohini, and you are welcome to Unacademy platform. And here is some of my credentials. So I have MD from KMC, Kasturba Medical College, Mangalore, which is located in Karnataka. And I also have PhD from Savita University, Chennai. Here in the PhD, I worked on the thesis based on a animal model, diabetic animal model. So we used those albino mice for the studies, and that is wound healing properties is what we wrote on. And this is MT and MBA degree. So that is from the Georgia University, Atlanta. And this is in USA. And this one is one more, which is not listed here. That is ART, Assisted Reproductive Technique. I love doing this job because this is like a stress buster for me. You should always have a plan B, plan C, etc. So in case you're bored with one thing, you can do something else. So this is ART, Assisted Reproductive Technique. If you are interested in reproductive medicine, this is something you can look at. Or if you are interested in gynecology and you are someone who already completed gynecology and post graduation, then this is something that will really interest you. Assisted reproductive technique, you can also work as an embryologist in IVF centers. So it will train you in ICSI and IVF procedures. So this is one of my stress buster. I do work as a freelancer as well. So, okay. So with all these credentials, let's move to the topic. So here is the first one. So here it tells you, okay, here it tells you endocrine unit of pancreas is. So there is exocrine unit and endocrine unit. So endocrine unit of pancreas is. What do you think is the endocrine unit? So here is a picture where you can see the intralobar ducts, and then you can see some capillaries between the acini, and you can also see those acinar cells, and you can also see centroacinar cells. So this is the pancreatic acini. You can see the pancreatic acini, they are very much, bright, and the lumen is small. And all these cells, you can see that they're all pyramidal in shape, and they have some kind of granules. Did you notice them? They have some granules. They are called zymogen granules. And these granules are the ones which give the pigment to these cells. And when it comes to the nuclei, they are round and centrally placed. When it comes to the mucus glands, the same nuclei will be flat and it is near the base of the cell. Okay, that is mucus. So these are purely serous acini. Serous acini will take up a lot of eosin staining, so they look more pink. And adding to this pink is the zymogen granules. It gives even more brighter color compared to the mucus acini or any other mixed acini. So mixed, one example would be submandibular salivary gland, pure mucus would be sublingual, and the serous would be the example for either pancreas or parotid gland. So remember, the parotid and pancreas, both of them have serous acini. All right. So now here you have pancreatic acini cells. There is islets of Langerhans, von Ebner glands, which are mucus secreting glands, and centroacinar acinar cells, these are purely exocrine in nature because they're connected to the ducts like that. You can see they're connected to the ducts. So what is endocrine? Endocrine are the ones which are hormone secreting and it is released into the blood. So you can see them in those islets of Langerhans. So here I would pick the answer as B. Okay, so that is B. And you can also remember a little more about centroacinar cells. What is so special about centroacinar cells? Centroacinar cells are, as you can see, they are all spindle shaped. So that is one thing. Then another point would be they are exocrine part of the cell. Exocrine part they belong to, and they always belong to the extension part of intercalated duct. Intercalated ducts. Okay, that is one thing. And the next point would be these are commonly known as duct cells. The other name for this is duct cells. Then next one, we can say that they secrete aqueous bicarbonate solution and stimulated by which hormone? Stimulated by a hormone called by hormone secretin. Secretin. So this is what stimulates the cells to secrete an aqueous bicarbonate solution. So remember, this is the centroacinar cells. They are exocrine part of the pancreas and they secrete their content into the ducts. So that's why they're called duct cells. Okay, so that is the MCQ first one. So here we are supposed to find the endocrine part. So the answer is B. All right, so the next one, during the anatomy practical examination, okay, you call the student who is always, let's see, what is the question? So here we have, let's see if there is anybody who is trying to ask a question or, okay, so we have, Sri Karthik is there. Okay, Sri Karthik B. During the anatomy practical examination, you call the student who is always fond of playing football and demonstrates aversion of the foot. Aversion of the foot. Okay, remember the keyword aversion of the foot. Okay, there the foot has many actions. And let me just tell you, the ankle joint is present and then you have another joint near that area that is called subtalar joint. Okay, so ankle joint helps in what? Inversion. Sorry, it helps in dorsiflexion and plantar flexion. Okay, Sri Karthik ready? And there is subtalar joint where you have inversion and eversion. Eversion. These are the two actions. But we are talking about subtalar joint action. We are talking about eversion. And eversion is done by only one set of or one group of muscles. They are called the lateral compartment. Lateral compartment has two muscles in its credit. They are called peroneus longus and peroneus brevis. So we are talking about the lateral compartment. I would just remember the lateral compartment as PLES. What is PLES? P is for plantar flexion, L is for lateral compartment, E is for eversion, and S is for superficial peroneal nerve. Okay, that is a mnemonic for the lateral compartment. So now here we're talking about eversion of the foot, and this is usually caused by which muscle is a question. It is by the peroneus longus muscle. What is extensor digitorum? Where is this? This is present in the anterior compartment, and tibialis anterior is also part of anterior compartment. So these are the anterior compartment muscles, the extensors. The lateral compartment is the peroneals. So this is lateral compartment muscle. All right, so let's see what else we have. Just give me a second where all right. So next one, the tendon of which of the following muscles is stretched during the patellar reflex? So there is tendon of which muscle that is stretched during patellar reflex. So patella is the sesamoid bone that is actually formed in the tendon of quadriceps. Okay, quadriceps belongs to the group of muscle which does knee extension and hip flexion. This is what it does, quadriceps. Okay, it has four muscles, like it can say that, quadriceps, the name itself indicates you there are four muscles. There is a straight muscle called the rectus femoris. Then there are three vastus. So you can just remember the patellar reflex, is stretched during which muscle tendon is stretched. You have to remember it is a quadriceps. So here quadratus femoris is also there. That is going to little confuse you. But this one is the lateral rotator of hip. So don't get confused. That is different. This is quadriceps. This is the muscle which is going to do knee extension, and that is the one which is going to help in patellar reflex or going to be stretched during patellar reflex. All right, so the answer is A. The answer is A here. What about sartorius? Sartorius is the muscle which is in the anterior compartment. So it is going to do flexion of the hip. What about pectineus? Pectineus muscle is also one of the muscle which forms floor of the femoral triangle. All right, so let's move to the next one. Here we have, here we have another question which is about the triceps. So now here it says the lower limb also happens to have a triceps known as triceps surae. So this is not the triceps that we are talking about in the upper limb. We are completely talking about the triceps surae that is in the lower limb. Lower limb, leg portion of the lower limb. Okay, so here it is the three muscles which are together forming a tendon called the Achilles tendon. So this muscle, three set of muscles are called triceps surae. So this includes which of the following muscles? So who can tell me? Manoj says C. Manoj says C. Extensor hallucis, extensor digitorum, popliteus, and plantaris. Lower limb also happens to have a triceps known as triceps surae. This includes which of the muscles? Does it include any of this? Plantaris, popliteus, extensor hallucis, extensor digitorum? Anyone? In fact, it does not include any of them. So there is triceps surae that is actually formed by the gastrocnemius. Okay, gastrocnemius and soleus. Okay, two heads of gastrocnemius. So this is what is going to give you triceps surae, and it gives you the tendon, Achilles tendon. So here the plantaris actually won't come into picture. Plantaris and popliteus also no. There is extensor hallucis longus, extensor digitorum. Popliteus forms the floor of the of the fossa. So you can include poplatus, but that is not a part of triceps rib. Okay. So here there should have been an option none. So none of them form the triceps rib. All right. So where is plantaris? It actually forms the floor of the femoral triangle. This one forms floor of the fossa, that is popliteal fossa. Then extensor hallucis is in the anterior compartment. Extensor digitorum is also in the anterior compartment. Okay, next one. In Erb's palsy, this question is about the upper limb. So in Erb's palsy, you tell me. So students, please do answer. Abhishek says A. In Erb's palsy, now answer this particular question, Abhishek. In Erb's palsy, loss of C5, C6 roots leads to malfunction of which one? C5, C6. It is from the upper trunk, okay? Upper trunk leads to malfunction of which one? So we have C5, C6. It is exclusively the axillary nerve. You just think axillary nerve supplies to which muscle? Axillary nerve supplies which muscle? We have, is it infraspinatus? Is it subscapularis? Is it deltoid? Is it biceps, pronator? What are these? Let's just look at the nerve supply of all these. These are supplied by nerve to supraspinatus. Okay, this one is supplied by axillary. And this one is supplied by musculocutaneous nerve. And this one, pronator teres, is present on the, is it in the flexor compartment or extensor compartment? It is in the flexor of forearm. It is supplied by median. So now here, which one has the root value C5, C6? It's the axillary nerve, and axillary nerve supplies deltoid. So this is the one with the loss of roots leads to malfunction of the deltoid. That is true. But musculocutaneous also has the root value, the same thing. That is again true. And then there is nerve to supraspinatus that also has the same root value. So true. But this is the one which may not have the same root, C5, C6 roots. So this one also has, but at the same time, there are many other also which can help in. So this is false. Actually, we can put this also under false because there are other roots also which can help. So this is no, this is no, this is no. So it is the deltoid and biceps brachii which is supplied by musculocutaneous. The root value for this is C5, C6 and C7. Okay. Next one. The question is radial nerve. Your radial nerve, if damaged in the forearm, it gives a weak grip. Is it true? If damaged in the forearm, it gives a weak grip. Is it the muscle for gripping? Supplied by radial nerve or ulnar nerve? It is supplied by ulnar. So radial nerve has got nothing to do with that. So it is false. Next one. It has, okay, this is not true. It is false. It has cutaneous branches which cross the anatomical snuff box. That is true. Next, it is a direct continuation of posterior cord of brachial plexus. That is also true. What about the next one? Anybody? It contains C4 nerve fibers. Does it contain C4? That is not true. Then it is false. It gives an additional supply to brachialis muscle. Radial nerve does not supply brachialis. It only supplies the triceps region or the extensor compartment of the arm. So this is also false. So here we have the answers which are correct is only B and C. Okay, about the radial nerve. Next one. Let's move to the next one. Okay, here we have the deep branch of ulnar nerve in the hand supplies. The deep branch of ulnar nerve in the hand supplies. What does it supply? So there is a superficial branch and a deep branch. So what does the superficial and what does the deep branch of ulnar nerve supply? So we have adductor pollicis, lumbricals, abductor digiti minimi, only lateral to intraossei palmaris brevis. So here we have to understand the supply of the ulnar nerve. What about adductor pollicis? Yes, it is supplied by ulnar nerve. All the lumbricals? No, it is only the 4 and 5 are supplied by ulnar. Abductor digiti minimi? Yes, it is supplied. What about only the lateral to intraossei? No, all of them are supplied by ulnar. So this is also false statement. What about palmaris brevis? Palmaris longus and palmaris brevis. So that is again a true thing. So these are the supply of ulnar. So it is A, C and E. These are the supply of ulnar. It's ulnar nerve supply. Okay, let's see if there is anybody who is answering. Next one. We'll move to the next question. Here in the brachial plexus, now we are talking about the brachial plexus. You have to remember the brachial plexus, their roots and other things. Now here the first one is upper subscapular nerve is a branch of medial cord. Lower subscapular nerve is a branch of posterior cord. Suprascapular nerve is a branch of upper trunk. Thoracodorsal nerve is a branch of posterior cord. Musculocutaneous nerve is a branch of medial cord. Now let's see what are the answers that students have to give. Right, let's see the upper subscapular. Upper subscapular is a branch of medial cord. Is it a branch of medial cord? Upper subscapular. It is wrong. It's a branch of posterior cord. No, it is a branch of posterior cord. Lower subscapular. Let's see. Lower subscapular is also branch of posterior cord. This is true. What about suprascapular? Let's see who has written suprascapular. It is a branch from the upper trunk. That is correct. What about thoracodorsal? That is also called the nerve to latissimus dorsi. Thoracodorsal is from the posterior cord. That is correct. Musculocutaneous. Who has written about musculocutaneous? Musculocutaneous is a branch from the lateral cord. It's not medial, it is from the lateral. This is false. These are all false. The first one is also false. So the answer is B, C and D. So these are the correct answers. Correct statements, I can say. Okay, next one. You have to have a good visualization about the picture. You have to recollect the diagram of the brachial plexus to recall all the branches. You remember one good diagram which has all the branches, all the trunks and everything marked in it. Then it will become easy for you to recall. Next one, the brachial plexus. Now we are again talking about the brachial plexus. It has a middle trunk that contains only one root. It contains middle trunk, only one root. Correct. That is from the median nerve. Median nerve, you know, middle trunk has only one root. That is correct. All right. It is from the C7. Correct. Next, it has three cords which lie behind the clavicle. That's also correct. Next, it contains three trunks which lie in the posterior triangle of the neck. It contains C8 fibers in the upper trunk. No. It forms a median nerve which has C8 fibers do not come in the upper trunk. It comes in the inferior or the lower trunk. It forms a median nerve which has contributions from both the medial and lateral cords. Median nerve contribution from both medial and lateral cords. So that is also true. So the only answer here wrong is the D1. Rest all of them are correct. Okay, let's go to the next one. Okay, let's see the next one. Cutting the musculocutaneous nerve in the axilla results in weakness of what? If there is a damage to the musculocutaneous nerve in the axilla, what does it, result in? What kind of weakness it results in? So here we have pronation, flexion of the elbow, abduction of the shoulder, supination of the forearm, initiating the abduction of the shoulder. Which one does initiation of the shoulder abduction? That is done by the supraspinatus. Supination of the forearm is done by supinator. Biceps, brachii. Next, abduction of the shoulder is done by deltoid. What about flexion at the elbow? It is all done by the flexors of arm. Pronation is done by pronator teres and pronator quadratus. Okay, so this is what you have to remember. Now, cutting the musculocutaneous nerve in the axilla results in weakness because musculocutaneous supplies the flexors of arm. We have to remember that. Plus, it also helps in supination. So, that also could be affected. Supination also could be affected. So, you have to remember one is true. Supination of the forearm is affected. And also, flexion of the elbow is affected. But that is done by flexors of the arm. Nothing will happen to the pronation because pronator teres and quadratus are not affected. Then there is abduction of the shoulder, no. And initiation of the abduction also will not be affected. Answer here is B and D. Okay, B and D. So that is the answer. Next one. Let's go to the next one. A nerve which lies vertically on the lateral aspect of the serratus anterior. So you have to remember where the serratus anterior is. It takes from 1 to 8 ribs origin. So 1 to 8 ribs and vertically on the lateral aspect of serratus anterior. So we have to see a picture which shows you which one lies lateral to serratus anterior. We have subscapular, we have thoracodorsal, we have dorsal scapular, long thoracic nerve and axillary nerve. So since the long thoracic nerve supplies the serratus anterior, it also lies lateral to the serratus anterior. We would pick vertically moving muscle and vertically moving nerve is long thoracic. Rest of the things is no. So the answer here is D. That is lateral. There is also medial aspect. There is a nerve, but we have to pick that is thoracodorsal, but we have to pick the one which is on the lateral aspect. All right, let's see what we have. Next. Okay, here is the next question. Sensory changes from a cervical rib would be. So what are the changes from a cervical rib? Where is cervical rib first of all? It is on the C7, C7 spine. That is on the transverse process it is attached. Not the spine exactly, it is on the C7 transverse process. You have an extra rib attached and that is called cervical rib. And C7 is a very important, nerve vertebrae as for that matter. It is also called vertebra prominence. Vertebra prominence. So here you can see the sensory changes from cervical rib would be over the medial aspect of the forearm. So what nerve do you think would get compressed from the cervical rib? So over the medial aspect of the forearm, over the lateral aspect of the forearm, over the regimental patch or the badge area, in the distribution of the T1, specifically over the first dorsal web space. So which one do you think is the answer? Cervical rib would be noticed. Sensory changes from a cervical rib. Cervical rib would affect all those structures that are emerging from the upper trunk. So upper trunk would be the C5, C6 region. So this is what is going to be compressed. So since C5, C6 is going to be compressed, you should remember that these are the structures that could get compressed, and it would be the distribution of the C5, C6, that is regimental patch area, that is from the axillary nerve. So it is the answer C. Okay. Next one. The ulnar nerve in the hand is assessed by testing. What test do you do to assess the ulnar nerve? So here there is a sensation on the medial side of the ring finger, ulnar nerve, medial side of the ring finger, sensation on the dorsal and distal part of the little finger, and abduction of the thumb. No, that is not ulnar nerve, so it is false. Adduction of the fingers, yes, because you are talking about interossea here. What about adduction of the thumb? So that's also not talked about in ulnar nerve testing. So sensation on the dorsal and distal little finger. Dorsal and distal part of the little finger. That has got nothing to do with the ulnar nerve. And sensation on the medial side of the ring finger. Yes, it is. So it is A and D. A and D. So these are the answers. A and D are the answers. Okay, let's see the next one. Damage to the ulnar nerve at the medial epicondyle would give loss of, where is medial epicondyle? There is lateral epicondyle, there is medial epicondyle, and related to medial epicondyle is the ulnar nerve because it passes through a small tunnel there behind the medial epicondyle it is, and it is well protected behind the medial epicondyle. Unless there is a fracture of the medial epicondyle, the ulnar nerve will not be touched and it is pretty safe there. So here, damage to the ulnar nerve can happen at the medial epicondyle because of the fractures, because of the trauma. But what is the consequence of that? Adduction of the thumb? No, that has got nothing to do with it. Cutaneous sensation on the lateral side? No, that's also not. What about abduction of the fingers? Adduction and abduction of the fingers. Dab and pad, remember, both are done by the ulnar only, supplied by ulnar only. So it is true. Flexion of second proximal interphalangeal joint. Second proximal, that is index finger. So it has got nothing to do with it. What about radial deviation of the wrist? No, radial deviation is not ulnar supply, it is the radial. So it is the false statement. So the answer here is C, the correct one. C is the correct one. Next, we have some dedications and a profile picture, how it looks, so that you can easily recognize my profile. So here you have my profile, and you can also see the number of followers. The number of followers, of course, it is doubled, courtesy my dear students. And these are some of the dedications from the students. And thanks for all those dedications on the Teachers' Day. And really, really, I'm happy to have students like you. Thank you so much. And these are some of from my favorite students I have displayed, and I'll be displaying all of them because we cannot display everything at once. I'm picking a few per week. All right. And here we have Telegram channel. It is Let's Crack NEET PG. And you can also join Anatomy by Dr. Rohini, where we can discuss even more, questionnaire, questions, and MCQs, and keep you on your toes till your exam date, so that you are thoroughly prepared and have gained a lot of courage and, the proficiency in solving those MCQs should be there to crack your NEET PG. All right, so this is the plus and the iconic subscriptions, where plus and iconic are really nice because it covers the entire curriculum, and also it gives you a good study planner. There is personal guidance, rapid revisions, and also you have access to prep ladder in case of iconic subscription. And you will also get study material in case you go for 12-month subscription. And here is ask a doubt. In case you have questions or doubts, you can just clip that question and send it to your educator. And you can also see there are special classes on Wednesdays. These Wednesday special classes are really special because it starts as early as 7 a.m. and it goes on till 11 a.m. And you can look upon all these classes because you have a good sequence, and you also have lot of knowledgeable things that is happening from morning till evening. And in my case, it is most of them are MCQs based and everything is solved. So you have the answers are also ready, and you will be able to just take it in as is because everything is ready made and given to you. So this MCQs you can participate, and the times and date will intimate you shortly. Please look forward after you download your app, that is Unacademy Learners app. Please look forward for all the notifications from Rohini YN. So you can also download and use the code ROHINI10. So when you use the code, you will be definitely be able to access all this. And here is special class features, interactive polls, and raise a hand feature, and you'll never miss a class. All these are some of the special features of these special classes, which you don't find anywhere else. And these are some of the steps to get the subscription done. You can go pick the goal, see what preference you have, and also you can go for the number of months subscription with the payment. And here is your install Unacademy app, Learners app. Through this method, the Google Play or App Store will give you the app exactly what you need for your special class attendance. So you can go through these steps, and then you can please download and keep it ready so that you are ready for the special classes. This is Bugs Bounty, where opportunity is given for all the learners to report anything that is inappropriate. You want to report anything inappropriate, you have to do through Bugs Bounty link. There is subscribe, like, and share. When you do so, you will definitely be notified about the classes. And it is as simple as not, going to browse around and look for or search for some particular class. You will get the notification. It's very simple. You just join the class whenever you get the notification. So at the end of the class, you download the PDF and you have it ready till your exam. And it's not even going to occupy so much space in your phone because everything is in the app. So here is referral code ROHINI10. Use the referral code to get all the freebies access and also to get 10% discount on the subscriptions. You have to use the code no matter what you do, no matter how you go about it. The code is very important. And here is plus subscription, and there is also iconic subscription with the Unacademy and Prep Ladder. You can get both the access, and the fast-paced educators from both the platforms will teach you. And this is batches starting on 18th that has been just started, and it is going to go on till 11th of September. And there is 1 month package that is running right now. You can also get access to 25,000 plus questionnaires and the clinical based questions. These are all, this is just for those exam cohorts, and keeping you in mind, everything is designed. And this is boost your medical PG preparation with the 12 plus 2 amazing offer. 2 months is completely free. And there is also 4 year subscription. You can get the 4 year subscription and you can have endless access for 4 years with just INR 60,000 for plus subscription, and iconic will just attract 75,000. And here is the plus and iconic subscriptions. You have 48,000 for 1250 per month only. And here 1406 only per month for iconic subscription. So all this comes to you when you use the code ROHINI10. So use the code, and also don't forget minimum of 6 months is a requirement to get the EMI option. So there is grant test series, and you can see many things are lined up. Grant test series are from 4th till 11th, and all the dates you can block for all your grant test series. So with all these, myself, Dr. Rohini Wayan, so you can definitely attend all my classes when you have downloaded the app and when you have started following my profile. So follow my profile, use this username in case you want to look for me. When you use that, please hit a follow button. So when you start following me, you will get notification about all my classes without fail. So see you then in the next class. Thank you so much for watching. You have a good day.